Guys, my name is Anita Brahma. Today I am going to perform head-to-toe assessment. Let's begin. So first, before I start, I am going to clean my hands, do hand sanitizer, perform hand hygiene, and then I am going to wipe my stethoscope with the alcohol swab. Okay. Then knock knock knock. Hello, my name is Anita Brahma. I will be your student nurse today, and I am going to perform head-to-toe assessment on you. Is that okay?
Yep.
Okay. Can I see your wristband, please? Can you tell me your name?
My name is Achapong Wongpongchan.
And your date of birth?
24 February 1982.
What can I call you by?
You can call me my nickname.
Your nickname. What is your nickname?
Golf.
Okay. And can you tell me your age?
33 years old.
Your height?
173 cm.
And your weight?
63 kg.
Okay, sounds good. And can you tell me where you at?
165 Colborne Avenue.
And what day is today?
Today, April 12.
12. Okay, perfect. And then I am going to correct the vital sign, which is blood pressures, heart rate, respiratory rate, temperatures, and the oxygen saturated. While I'm checking his vital sign, I am also going to do the general survey. I'm gonna check for the physical appearance, like age, sexual development, skin colors, sweat, smell, behaviors like facial expressions, his mood, speech, his dress, his personal hygiene, the eye contact, and I'm also going to check for the body structures, the body builds, the contours, his height, symmetric, and I am also going to check for workout breathing, sign of any distress, and lastly I'm going to check for alert and oriented. So does he understand me? Is he having any hard time hearing me? Any delays when he responds? And does he respond me appropriately? Okay, so I didn't see any abnormal sign. I am going to move on to assess his head. So we're gonna do inspect and palpate. So we're looking at his head size. It's a good size matched with his body. At midline, symmetric, the facials, any drooping face, the eyes, the ears are the good levels, the mouth and the nose at the midline. Okay, so we're gonna check for the lumps, bumps, lesions, bruisings, the colors, moistures, edema, hair distribution, texture, temperature, tartars, tenderness. I'm just gonna go ahead and palpate his hairs and hair textures. I'm looking for any skin breakdown, any investigations, any swallowings, any lumps, bumps. Do you feel any tenderness hairs? Do you hear?
No.
Okay. And we're also gonna check for the front bodies. And then if the patient had the beards, we're also gonna look through the beard as well. Okay. Then we're gonna do the facials. Then I'm gonna check for the cranial nerve number 7, which is the facial nerve. I'm gonna ask him to smile. Can you make a sad face later on? Can you close your eye tight? Well, let me open them. Okay, can you show me your teeth? Pop up your cheek. Perfect. The cranial nerve number 7 intact. Then I am going to move on to the cranial nerve number 5, which is trigeminals. Can you close your eye for me, please? Say yes when you feel something, okay?
Yes, 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 yes.
Okay, just open your eyes, open your mouth, close your mouth, crunch your teeth. Okay, so I feel the nice firm balls of the muscles, the cranial nerve number 5 intact. Then I am going to move on to the eyes. So we're gonna look outside, the eyelash, the iris, the pupils, sclera, conjunctivals. Okay, so we're gonna look at the color, the vessels, the size of the pupils, the eye shapes, the symmetric, lid lag, any drainage, any redness in the eyes, and then look it, and also the lashes contribution. I mean the lash distributions. And then I'm gonna check for the cranial nerve number 3, 4, and 6, which is oculomotor, tragus, and abductions. So first, I'm gonna check for the involuntary checking of the eyes. I'm gonna ask my patient to stare at the pen while I'm performing 6 fill-up gates. Look at my pen, keep your head still, move just the eyes, okay? Okay, and then now I'm going to check how reactive the pupils are to line. So I'm gonna ask you to stare at the water bottles over there. Okay, so both eye constrict, even the one that I didn't shine the light, which I get, and then I am going to check for the accommodations. I'm gonna ask you to stare at my pen again. The accommodation is good. So now I'm going to document for the pora. So the pupils are equal loud, reactive to light in accommodations. Okay, and then I am going to move on to the ears. So the ears, we're gonna do inspect and palpate. We're looking at the lumps, bumps, lesions, bruising. We're looking at the colors, the moisture, hair distributions, edema, textures, redness, swallowings, and any drainage on both sides. Okay. And then if we have the otoscope, we are going to use the otoscope to look inside of the ears. We're going to look at the tympanic membranes. The good looking one should be pearl gray, translucent color, and should be shiny. So I don't have it, so I'm just going to leave it for now, and then I'm going to go ahead and palpate it. Any tenderness?
No.
Okay, and then I'm going to move the tracheus a little bit. You heard?
No.
Okay, everything good. Then I'm going to perform the whisper test. This test going to help me to check with the cranial nerve number 8, which is vestibulocochlear. Repeat after me, please.
Water, banana.
I'm gonna do the other side.
Chicken, pencil.
Okay, perfect. So the cranial nerve number 8 intact. And then I am going to move to the nose and the sinus. So we're gonna inspect and palpate. So the lumps, bumps, lesion, bruising, any drainage. Symmetric is at midline. And we're also gonna look at the septum. Is it deviated? Okay, so good. And then hair distributions, colors. So we're gonna palpate for the sinus, for the maxillary. Any tenderness?
No.
And the frontals?
No.
No, I'm good. Perfect. Then I'm gonna check for the cranial nerve number 1, which is the olfactory. I'm gonna ask you to close your eye for me, and then I'm gonna close one of his nostrils and introduce some scent.
Coffee.
Keep your eye closed for me. We're gonna do the other side.
Orange.
Perfect. So the cranial nerve number 1 is intact. Then I'm going to move on to the mouth. So we're gonna do inspect and palpate as well. So we look at the lips, symmetric. We look at the lip color. We do the LV, lumps, bumps, lesions, bruisings, any scar, any sign of dehydration, the color of the lip skin, and then open your mouth for me, please. So we're looking at the inside, the gum, the color of the gum. We're looking at the teeth, any loosening teeth, any repairs. We're looking at inside of the cheek. Open your mouth, please. Looking at inside of the cheek. We're looking at the tongue and bottom of the tongue, yep, and the base of the tongue. We're looking at the color, the redness, swallowing, any fungus, and I'm gonna check for cranial nerve number 9 and number 10, which is esophageal and vagus. I am going to ask you to open your mouth, put your tongue out, and then we're gonna check the palate here. And say Okay, so when he said I see his soft palate and the oil move up, which is good. And then I just check for the gag reflex. He's also had a good gag reflex. So the cranial nerve number 9 and number 10 are intact. Then I am going to move on to do cranial nerve number 12, which is hypoglossal. So the hypoglossal, you put your tongue out for me, move it side by side, say light, tight, dynamite.
Light, tight, dynamite.
Cranial nerve number 12 intact. Then I am going to move on to the neck. So can you look up for me? We're gonna look at his tigers at midline, and then we're gonna do the lumps, bumps, lesions, bruisings. We're checking for the colors, edema, moistures, hair distribution, the texture, the tigers, tenderness, temperatures. So everything looks good. We're gonna palpate the target at the midline, which is all good. And then I am going to do the carotid artery. So the carotid arteries, I am going to do it individuals. We don't do bilaterals. We do it only one at a time. It's a good rhythm. It's about 2 plus. At the side. Okay, these are some good rhythms. 2 plus, which are good. And then I'm gonna palpate the lymph node, the thyroid gland. Let me know if you feel any tenderness, okay? So we feel for any superficial massive. Any pain?
Nope.
Okay, so, and then I am going to check for the cranial nerve number 11, which is this accessory. So can you rest your shoulders? Good. And then can you move your head side by side? Check your head. Okay, looking up and down. So the cranial nerve number 11 is intact. And then I am going to do the upper bodies. I am going to inspect and palpate. So the lumps, bumps, lesions, bruisings. We're looking at the skin color, the moistures, hair distribution. Can I have your hand, please? I'm going to check for the radial pulse. They are equal, 2 plus, which is good. And then I'm gonna do checks the hand, the fingers, the nails. There is any club nails, any sign of malnutrition. We check the joints, swallowing joints, the redness, and then we're gonna check for the nail capillary. So I'm just gonna push and let it go. So the nail refill within 2 seconds, which is good. And then we're also gonna check for the muscle tone. Look nice, the body is symmetric, good. And then can you open your finger wide? Don't let me close them. All good. Can you do this to me? Perfect. All good. And then push. Okay, and do this. Well, let me pull you. All good. And then I'm just gonna check your joints here. Okay, so then can you open up your arms? Up high. Okay, rotate your arms for me. All good. And then rotate your wrist. Perfect. And then can you take off the top off for me, please? Then we're gonna check for the chest. We're gonna check both anterior and posterior. So we're gonna inspect and palpate. So lumps, bump, lesions, bruisings, the colors, the moistures, hair distributions. We're also gonna check for any edema, the tuggers, any redness, any scar, any regions, any abnormal of deformity, the skeletal deformities, and then no bruising. Check the back as well. So we have the spinal cord at the midline, and the body is symmetric. Then I am going to listen to the lung and heart actually. So let's start off with the heart first. There are 5 locations to listen to. Okay. Can you show me your right arm? Perfect. So the first spot is aortic. It's going to be at the right sternum bottom at the second intercostal space. So it's about right here. So this one we're listening for the S1 and S2. And then I'm going to move to the left side, still at the second intercostal space. This one is harmonic. S1 and S2 still. These 2 spots we're gonna hear S2 louder. And then I'm going to move a little bit down to the third intercostal space. This one is the herb point. There is no valve in this location, but it's in between the base and the apex of the heart. Then I'm going to move a little bit more down to the fourth intercostal space. This one is for tricuspid. Loud up, loud up. This one I'm going to hear S1 loudest. And then we are moving down to the fifth intercostal, but a little bit more to the left side, to the midclavicular line. This one is called mitra. We are using this location to check for the apical pulse. Good. And then we're gonna switch to the bell side. We're listening to the same 5 spot. We're listening for the murmurs. So the murmur is switching bowing sound. It's abnormal sound of the heart. Okay, and then I am going to listen to the lung. I'm gonna start off at the apex of the lung. So for the lung, take a deep breath for me. Good. For the lung, we're gonna listen it side to side to compare both sides. So we are listening for crackles, wheezes, friction rubs, and a strider. Okay, can you stand up for me and turn your back? We're also gonna listen from the posterior as well. everything all good? I didn't hear any abnormal style. And then I'm gonna ask you to sit on the bed here and put your feet over there. Actually, yeah, lay down here. So now I am going to move on to the lower part of the body. So we're gonna do inspect and palpate. So the lumps, bumps, lesions, bruisings. We're also gonna do for the colors, hair distributions, moistures, edema, the tiger, tenderness, temperatures, and the textures. So we're gonna look at the feet, and then we check for edema. We check for the joints, any swellings, any redness, and look through the feet, the nails, the toenails, the joints, any swallowing, any redness, the temperatures, warm to touch. Then we check the nail capillary. Okay, so the nail will fill back within 2 seconds, and then there is couple spots that we going to check for the pulse. Yes, so that is called the posterior tibials. Just right here. Okay, we check both sides. They are equal. It might not be strong as the apical pulse. Not the apical pulse actually, the radial pulse, but you still can feel it. They are equal. And then the other one is the dorsalis pendus. Just right here. Okay, they are equal. Perfect. And then I'm gonna check for his muscle strength. Can you push? Okay, lift up your feet. Good. Can you try to pull your leg up? Put your leg up. Good. And then pull your leg up. Well, let me put it down. Good. Okay, and then while he laying down, I am going to check for his stomach as well. So we're going to listen for the bowel movement, and we're also gonna palpate. So I'm gonna check with my patient first. Do you have any problem with your stomach?
No.
When was your last bowel movement?
Today in the morning.
Any difficulty while you urinating?
No.
Okay. Then I am going to auscultate. So I'm gonna listen to the bowel sound. So we're gonna start from the right lower quadrant, and then we're gonna work the cox whiles. So it's like this way. So the right lower. Okay. So we should hear about 5 to 30 sound per minute. And then I'm going to do the light palpate. So for the light palpations, I'm gonna feel for any tenderness, any tenderness hairs, any lumps, any bumps, any mass. Then you don't really feel anything, so any tenderness, any pain. All good?
Yep.
And then I am going to do the deep palpations. So let's go a little bit deeper. Any tenderness?
No.
No pain?
No pain.
Okay. Perfect. And then I am going to palpate his bladder as well. Okay, all good. Perfect. Would you mind to sit up for me, please? Okay, and then I'm gonna ask him to to walk 5 steps for me. Walk 5 steps. Perfect. And then can you walk back with heel to toe? Good, perfect. And then I'm gonna ask you to open up your right leg. The right, okay, the left leg. Good, rotate your ankle. Good. The other side. Perfect. And you can grab a seat. Thank you. And then that is pretty much it for my head to toe assessment.